After Game of Thrones' infamous Coffee Gate, I asked myself the question what other real-life objects could find their way to Westeros and shape its story. Especially, how would digital health shake up the Song of Ice and Fire? At the end of episode 3 in season 3, Jaime gets into a bit of a trouble.
Never forget that. Yeah, this should help you remember.
He loses his hand, the one that made him the best Westerosi swordsman, and for the rest of the series, he has to live handicapped with an iron hand, losing the title of the Young Lion forever. If the digital health revolution would have reached King's Landing by then, Jaime could have gotten a prosthetic bionic hand and he could have stayed the dreaded young lion. In the very first episode, Bran gets tossed out of the window by Jaime and he gets paralyzed. For the rest of the series, he has to live in a sort of wheelchair and has to be carried by Hodor, who gets killed in the process. But with digital health, he could have gotten an exoskeleton, and hell, he could have held the door all by himself and fight the Night King. In case food scanners would have reached Westeros by the time of Joffrey's rule, he could have terrorized King's Landing for many more years. On the Purple Wedding, he could have just tested the food for poison and uncovered the whole coup before too late. Lady Olenna would have lost the Game of Thrones much earlier. With hemostatic tools at the Night's Watch accessories, even Jon could have been saved after he got brutally stabbed in season 5. With inventions like Extat and Vetigil, his otherwise fatal wounds could have been sealed instantly and he wouldn't have bled out on the snow. But I have to admit, after all that, the medical community in our world still envies what Melisandre could do. We have a digital health revolution, but we still lack expert red priests and priestesses. That would be something.